The debate surrounding the health impacts of radio frequency radiation, RFR, has been as persistent as the signal bars on our cell phones. With the rollout of 5G technology, concerns over RFR's potential biological effects have only intensified. A recent paper by Paul Ben Ishai, Devra Davis, Hugh Taylor, and Linda Birnbaum dives into this contentious issue, arguing that the precautionary principle should be our guiding light in public policy for RFR exposure. Understanding the precautionary principle. At the heart of the matter is the precautionary principle, a policy approach that emphasizes caution in the face of scientific uncertainty. In the context of RFR, this principle calls for proactive measures to protect the public from potential harm. Yet, the authors argue that when it comes to the regulatory landscape of RFR, the principle appears to be sidelined. The regulatory challenge. The Federal Communications Commission, FCC, and the International Commission on Non-Ionizing Radiation Protection, ICNIRP, currently set exposure standards based solely on thermal effects, ignoring a growing body of evidence suggesting non-thermal effects could be just as harmful. The authors review literature on in vitro, in vivo, and epidemiological studies that link RFR exposure to various health issues including cancer. A significant body of research, including key epidemiological studies like the Interphone study, Hardell Group studies, Serenat study, and comprehensive reviews such as the Bioinitiative report, suggests an association between RFR exposure and health risks. These studies collectively point towards increased health risks from cell phone-level electromagnetic radiation, highlighting potential carcinogenic effects and other health concerns. At the forefront of these findings are the U.S. National Toxicology Program, NTP, and the Ramazzini Institute study, which have both provided substantial evidence of carcinogenicity in animals exposed to RFR. In contrast to these alarming findings, some critics argue that non-thermal levels of RFR cannot have biological effects, a stance increasingly at odds with independent research findings. Advancements in RF radiation research have revealed biological interactions beyond thermal effects. FDA-approved treatments like Therabionic, which employ RF radiation at power levels significantly lower than those emitted by cell phones, have effectively treated inoperable liver cancer through non-thermal mechanisms. These include resonance effects, disruption of cellular signaling, and immune system modulation. This challenges the traditional view that non-ionizing radiation from cell phones is biologically inert except for its heating properties. Remind your friends and family to be RF safe. Visit us at www.rfsafe.com.